Based nonprofit Colorectal Cancer Alliance is urging all Americans to get back on track with colon cancer screenings. Today, we wear blue to raise awareness about colon cancer. Joining us now to continue this conversation is Michael Sapienza. He's CEO, Colorectal Cancer Alliance. Thank you for joining us, Michael. We really appreciate you, sir.
Thank you for having me.
Now, colon cancer rates are higher in African Americans and rising in younger people like Chadwick Boseman, who died of the disease at 43. Why is this disease having such a devastating impact on Black lives?
Yeah, absolutely. Unfortunately, we have in the African American community about a 20% higher incidence rate and about a 40% higher mortality rate. And, the number one reason why we're seeing this is systemic racism and continued health inequality. There's obviously some other reasons as well. So potentially some comorbidities such as diabetes, lifestyle, diet, et cetera. But really, we don't really honestly know besides systemic racism and health inequality. So one of the things we're really trying to do is to move forward and, with access to screening. So one of the most important messages that we can get across is, how do we make sure that people of 45 or older are getting a screening for colon cancer? So whether that's a colonoscopy or whether that's a FIT test, which is an at-home test, or a Cologuard, which is an at-home test, all of these tests will help save your life.
And I want to run some numbers down to you, Michael. Back in 2020, we accounted for about 12% of colon cancers. That's about 18,000 cases diagnosed in people under the age of 50 here in the U.S. How do we change those numbers?
Yeah, absolutely. Well, number one, we've now recommended, the Colorectal Cancer Alliance, American Cancer Society, and others have recommended lowering the screening age to 45. The powers to be, which we call the Preventative Task Force, have now have a draft recommendation to lower that age to 45, but haven't given us the final recommendation. So that's the first step, lowering that screening age to 45. And then number two, I think, is doing what you're doing right now, which is spreading this awareness on Dress in Blue Day and throughout the year for people like Chadwick Boseman or Craig Melvin's brother, Lawrence, who just passed away in December. For people under the age of 45, if they're having symptoms, so if you're having blood in your stool, change in bowel habits, unexpected weight loss, cramping, etc., and that persists, make sure you see either a primary care physician or a GI physician. And I would just advocate to have a colonoscopy at that point if you're having those symptoms, because what we found through surveys is that people that are diagnosed under the age of 50 see approximately 3 doctors. 85% of them are misdiagnosed. So what that means is if they had gone in 6 months earlier, and or that first doctor had said, you get a colonoscopy, their colon cancer may have been stage 1 instead of stage 4. So again, just be your own advocate.
Now, Michael, I like that you suggested those health concerns. If you encounter them, you should definitely seek a doctor. But Chadwick Boseman was 43. And I know you mentioned lowering the age to 45, but should the age be lowered?
Yeah, I think one of the things in the future that we will see is we'll start to see some more non-invasive screening. So Cologuard is a perfect example, or EpiProColon, which is a blood screening. But we have a couple other blood screening tests on the market that, unlike a colonoscopy, are cost prohibitive for people under the age of 45. But let's say you had a blood screening test that's about $150. And when you go in to get your cholesterol checked or your blood sugar checked, you could actually get checked for colon cancer at ages under 45. So we're trying to find more sensitive tests that could be less expensive, that when, again, the powers to be do the numbers to see the efficacy for people under the age of 45, that there'll be a test that could be used more broadly.
And also colon cancer screenings have dropped roughly 90%. Diagnoses have fell 32% due to the pandemic. Are we possibly looking at a wave of future diagnoses in the future that could have been avoided?
Absolutely. Yeah. Ned Sharples, who is the head of the National Cancer Institute, has already said we'll probably see, and this was just as of last June, 5,000 additional deaths. So, I don't want to go out on a limb, but my guess is we'll see at least 10 to 15 to 20,000 additional deaths due to the pandemic, due to the fact that people are not up to date on their screening. So I just encourage you to go to pledge.getscreened.org. Again, that's pledge.getscreened.org. You can learn information about colonoscopies or some of these at-home non-invasive tests, especially if people are afraid to go to the doctor right now or afraid to go to hospital systems. I think that's a really great alternative right now.
And Michael, you have a personal connection to this disease. Can you just tell us how you got involved with the Alliance and what your story is?
Yeah, thank you for asking. Unfortunately, my mom was diagnosed at the age of 56 with this disease, and she died on Mother's Day in 2009. And I say this all the time. I say, if she had gotten her screening at age 50 or now age 45, she would have been able to see me get married in 2016. Hopefully, I'm going to have some kids soon, so she would have been able to, see me grow up with those kids. So, if you're afraid of this procedure, I would just say, it cost my mom her life, the fact that she didn't get screened, and it could save your life.
Wow. Michael, first off, I want to say my condolences. And as a child of a mother who passed away from something similar to cancer, aplastic anemia at 41 years old, I completely understand your heartache and missing those moments that you want to share with your mother, especially having children, getting married. So we really appreciate you shedding light on this. Any last minute thoughts or resources that you can tell our viewers?
Again, I would just say be your own advocate, especially if you're under the age of 45. And I encourage anybody of any age to go to our website, ccalliance.org, or again, pledge.getscreened.org. And thank you. I really appreciate you having me on.
Thank you, Michael. It was a pleasure having you, and we look forward to welcoming you back to BNC Live. Thank you again, sir.